talk a bit about your solutions, if you will? You mentioned earlier to implement hard stop policies at hospitals. How did you go about doing that?
Salesmanship, marketing, confrontation with evidence, showing their evidence, and finding the right person in each hospital, and it's ideally a team. Now, we brought them into our quality collaborative conference. We had 150 come, and this is where it spreads. But you got to find it. Now, that can be an obstetrician in the community. It can be a maternal fetal medicine specialist and an experienced labor and delivery head nurse who backs it up. They have found that they can generally identify it. We bring a non-academic physician to the community to talk to their doctors, whether it's first thing in the morning or in the evening, about best practices. A lot of skepticism, and say, well, let's try it. And they get on board. And as more are getting the acceptance, they are learning from each other. The other thing is we have a very major influence coming. The Joint Commission has announced that PC01, elimination of less than 39-week non-medically indicated deliveries, is a standard. It was originally for July 1, 2013. I think it may be deferred a little bit, but I haven't heard that officially. That's going to drive every hospital to come on board. But you had to have some successes, and multiple states that have done it. And I went to FHA in Chicago, presented this in August. I was really impressed how they were doing it in the Midwest. They're more dictatorial than we have been able to be with 120 hospitals in Florida that deliver. But the word is spreading. The March of Dimes has been a great partner in getting out the information to women and a healthy start to women. So women are not accepting the doctors say it's okay to deliver ahead of time. Now, we do get confronted with some real emotional, hard decisions that I don't have the answer to. We have some major military bases. We have frequent deployments. We have husbands being deployed right at that point in time. Do you deliver? Because it's hard to get them back from Afghanistan. Although the Red Cross can help, it doesn't happen fast. And I try to say, we take you to a lower risk category if you wait. And it would really be better not to. But there have been some born early with that. Grandmother in Florida. Grandmother can only come at a certain time to help in the family and take care of the kids. And the airplane ticket is lower this week, but not 3 weeks later. That's not a good enough reason. Sorry.
There are also some hospital or physician resistors who really don't want to do the policy. So when it comes down to it, as John says, when you have those leaders and you're getting the change to take place, it will finally take everybody to coalesce and say, we will have a hospital policy, and everyone will follow that. In fact, in our pilot, one of the doctors threatened to leave until they discovered the other hospital that they were going to run to decided we better have the same policy. So there was no place to run. So there are some times when you get to that hard stop that everyone has to finally agree it needs to be in place, and those last few people need to come on board.